Good evening. I'm Cassandra, and I'm a member of the Quality Improvement Council for the Health Maintenance Organization that deals with managed care. Today, I am representing the nursing team. I intend to discuss how our healthcare system executes nursing sensitivity quality indicators while enhancing the quality and safe medical outcomes, revamping the nurse training approaches, supporting patient satisfaction, and developing evidence based practices. Kernet Thomas denotes that NDNQI is a nursing based database offering annual and quarterly reports concerning the process, structure, and performance indicators applicable in assessing the nursing service at different units. The data from NDNQI portrays the influence on healthcare workers on care quality, thus enlightening the audience about nursing capabilities regarding medical intervention for issues like patient falls. NDNQI still contains information assisting RN staff and nursing administrators to strategize the quality that like uh, improvement tasks like identifying the approaches for testing the healthcare practices and protocols. The NDNQI is also crucial for improving the patient's care and facilitating a conducive nursing environment that eliminates the complications of inconveniences interfering with the effectiveness of healthcare activities. As the representative for the safe implementation of evidence-based practice and promoting healthcare data reporting in different departments, it is vital to have a comprehensive understanding concerning the NDNQI. Now, let me explain NDNQI. The Nursing Sensitive Quality Indicators is a database developed by American Nurses Association in 1998 to improve healthcare practices. American Nurses Association guides the process of collecting information indicating the responsibility of nurses while promoting quality medical outcomes and ascertaining that they put the possible effects to enhance the patient satisfaction. Many hospitals utilize the NDNQ to assess the nursing implication on healthcare, familiarizes themselves with the way nurse-patient ratios influence the patient's outcome, and demonstrate how nursing impacts the workflow and workload in the clinical setting. The NDNQI database classifies the health-based results, structures, and processes, thus enabling the caregivers to quickly identify the factors interfering with the nursing activities. For instance, the database provides detailed information about nursing turnover and it indicates the care provider's hours on each patient daily. The data regarding the nurse-patient relationship helps the hospitals to make practical arrangements about staffing, financing, and determining the process or policies that improve the outcome and compliance in the health sector. More fundamentally, the hospitals apply the NDQI data to set the organizational improvement goals at the nursing unit and identify how the work environment or patient care has improved within a specific period. NDNQI is vital quality indicators for improving patient satisfaction and health outcomes. Now, allow me to talk about the nurse skill mix. The NDNQI has thoroughly addressed the structure indicators by demonstrating the relationship between the caregivers and patients. For instance, the nurses collaborate with different medical practitioners to implement and suggest the possible improvement measures for boosting the patient's outcomes through indicating the framework guaranteeing that nurses' skill and expertise align with the patient needs. For instance, the NDNQI indicators ascertain nurses understand themselves and acquire competencies that contribute to patient satisfaction. Besides, skill mix indicators demonstrate that healthcare facilities encounter medication challenges resulting from inappropriate operative guidelines, misdiagnosis, and the incapability of providing the patient with the correct dosage of drugs. Medication problems and lack of necessary skill mix disrupt health outcomes and make the patients and community members lose trust toward the involved hospitals, thus decreasing some hospital chances of receiving reimbursement. Therefore, the NDNQ structure indicators ensures that the hospitals incorporate a skill mix that improves nurses' performance and patients' outcomes. Let me explain the process for collecting and reporting skill mix data. Nurses can collect the data about skill mix while refurbishing the NDNQI structural performance rating and patient's outcome. These health caregivers must refer to their previous encounters with the different interdisciplinary team members, thus familiarizing themselves with the advanced expertise and professional capabilities contributing to the quality and safe care. The management in the healthcare facilities should still embrace nursing informatics and advanced technologies to mobilize the data that enable them to address the inconveniences disrupting the nursing practice. For instance, the application of electronic health reporting system, electronic medical records, and computerized provider order entry will guarantee the healthcare providers access to all the medical linked information for improving care quality within the nursing unit. The use of EMRs, EHR, and CPOE enables the interdisciplinary team members to share information through NDNQI, thus leading to successful evaluation of health-based performance in the hospital setting. Besides, the nurses integrating NDNQI with the advanced technologies acquire the necessary skills using available information to determine the patient's issues through proper diagnosis and provide them with the best medical intervention. Indeed, the nurses should use NDNQI to monitor the patients carefully, identify the problems existing through using available data, and adopt the health interventions that improve quality care. Let me discuss how health facility uses the data acquired from NDNQI. The NQNDI contains the information that enhances the interconnection between the nurses, patients, and interdisciplinary team in the healthcare setting, thus improving the care quality and ensuring that people seeking medical services are satisfied. Through NDNQI, the nurses use the technologies such as CPOE, EMRs, and EHR to gather the information that guides them while serving the patients and managing to offer safe medical interventions. For instance, the nurses use the data from NDNQI to get skills that help them handle misdiagnosis or misidentification issues. The information from this database is vital for eliminating practices that prevent the hospital from acquiring funding. The healthcare facilities that do not offer quality services are likely to lack government or public organizations' support because of failing to maintain a good reputation. The nurses still use NDNQI to gather knowledge about the current and anticipated issues in the medical field and make the necessary preparedness to address such problems in the future. NDNQI keeps the nurses updated about things and changes in the healthcare sector, thus providing them with the skills to successfully address varying medical issues. The ways my actions will impact the healthcare sector. My actions will enable our medical facility to offer quality care and handle different patients' experiences during daily activities. For instance, my skills concerning evidence-linked care and reporting tactics will be vital for mitigating the practices that might worsen the patient's health or delay their recoveries. Furthermore, by relying on ND&QI, I will get updated about the issues or changes happening in the healthcare facility and share them with other medical officers on time to improve the care services in the hospital setting. Indeed, the ND&QI database provides sufficient health-based information that enables health facilities to satisfy the needs of patients with different medical issues. Thank you.